Hi, my name is Pat Dunn, and I would first like to say what an honor it is to be able to participate in your program. While I'm presenting from a distance, I feel closely aligned with you and want to help you achieve your goals of reducing the impact of stroke across the globe. I am the Director of Digital Solutions for the American Heart Association Center for Health Technology and Innovation. As you might know, the American Stroke Association is a division of the American Heart Association, so we are interested in all aspects of prevention, management, rehab, and recovery from heart disease and stroke. I am also an adjunct assistant professor in the O'Donnell School of Public Health at UT Southwestern Medical Center and a contributing faculty in the College of Health Sciences and Public Policy at Walden University. My doctorate is in public health, and my specific area of interest is digital health literacy. I am both a clinical exercise physiologist and a software engineer. With that in mind, I've become very interested in all aspects of digital health, health technology, and artificial intelligence. Digital health runs the spectrum across the healthcare journey with multiple technologies, including apps, wearables, connected devices, telehealth, virtual and augmented reality, and artificial intelligence, and multiple conditions including heart disease, stroke, metabolic, and brain health. And it runs from primary and primordial prevention to acute and post-acute care and can be self-managed or connected to a healthcare professional. While there continues to be a lot of promise, the reality is that many of the promises that health tech will result in better health has yet to be fully realized. The bottom line is we need better technology. There are still challenges across the spectrum, from a digital divide to science gaps to measurement gaps and other barriers. We see the key elements of digital health outcomes include being a trusted source with a science-based approach, a connection to a medical or healthcare delivery system, a secure technology that allows delivery to large groups, an intuitive customer-facing interface, and the ability to continuously monitor and evaluate data. The world has changed. With the release of large language models and generative AI to the public, many new terms and a lot of opinions have emerged about the risks and benefits of these systems. It is important to learn these terms and understand what they mean as they become ingrained into our vocabulary. Terms like machine learning, natural language processing, neural networks, deep learning, generative AI, computer vision, voice technologies, and multimodal AI. Also, a shameless plug, we have published a review of the key terminology in AI and machine learning, which is published in our hypertension journal. There are big concepts like large language models, which use deep learning and large data sets, made possible by advances in computing power. Computer vision is used in automobiles and medical imaging and is used to recognize images and patterns. Voice assistants use natural language processing and speech recognition and use recurrent neural networks to automate repetitive tasks. AI is used extensively in health technology. Wearables such as watches and rings, and connected devices such as scales and blood pressure monitors can collect, store, and send data to the cloud and back to the healthcare professional. Virtual, augmented, and mixed reality can provide computer-generated scenarios that have wide applications and promise in stroke, especially rehab. Chatbots are computerized robots powered by machine learning and natural language processing to provide conversation and are especially effective for repetitive tasks. These tools can be used for creating personalized treatment plans in cardiac and stroke rehab, heart failure, hypertension, AFib, and other chronic conditions. Predictive analytics, medical imaging, drug discovery, surgical prep, simulation and training, analysis of the literature, medical and medication errors, clinical trial recruitment, and patient education. Programs that use these tools include digital therapeutics, which are evidence-based digital interventions, remote patient monitoring, which is a healthcare delivery model where data taken by the patient at home can be collected and accessed by a healthcare professional, and precision medicine, which creates highly personalized plans of care across multiple domains, including medical, lifestyle, and personal factors. For an example of how these technologies lead to programs, we start with the underlying technology, such as machine learning and natural language processing, leading to the use of large language models and computer vision. In the case of hypertension, connected devices and chatbots can be used in remote monitoring and digital therapeutics. This has led to a revival, in many ways thanks to the pandemic, but now includes the patient and the healthcare professional use of digital technologies and programs that can connect the dots. In our model, the key elements of health solutions include digital therapeutics and patient engagement, remote patient monitoring and connected health, science-based care plans and data analytics, and precision medicine, leading to shared decision-making, clinical decision support, signal identification, and content curation. This leads to optimized care coordination, improved equity and reduced disparities in care, improved quality, and elevating of patient-prioritized outcomes. The key elements are next-generation remote monitoring, digital therapeutics, AI and machine learning, advanced analytics and decision support, and guidelines, best practices, and content. We can think differently about how data inputs lead to outcomes. Rather than isolating and focusing on a narrow range of data points, we can use neural nets to help us understand the complex relationships among these different domains, from social to medical to lifestyle to personal and digital domains, leading to more highly personalized plans. Here's a brief example of how we translate guidelines into actionable steps to manage health. This is our engagement cube and includes the conditions on one axis, the risk factors and behaviors on another axis, and personal factors that really drive engagement, making this a cube. The technology solutions are the key to delivering and improving adherence, care coordination, patient-centered outcomes, shared decision-making, and decision support. It all starts with the science. The science is written by academics and printed in medical journals. So it needs to go through a translation into digital content to be consumed by both patients and consumers, as well as healthcare professionals. The content can be packaged into care plans and health journeys and delivered through technology solutions. Our innovator network companies can access AHA content that lives inside their solutions, allowing us to create digital science that is both professional and patient-facing, and especially exciting when we can connect both the professional and the patient into a digital solution. With anything that is new, there are both opportunities and challenges. The opportunities include better access and more convenience, better diagnostics and better care, as well as the potential to reduce administrative burden. These opportunities must, however, be balanced with concerns of deepening the digital divide, the cost of the technology, reimbursement or lack of, the potential for bias, hallucinations, and lack of transparency, and can be a vector of misinformation, and finally the potential for losing the human factor. So our key takeaways are to focus on human-enabled AI, health equity, transparency and trust, best practices, human-centered design, accessible and actionable content, more data and research, and creating a scalable, sustainable business model. Next is a brief excerpt from our digital professional training modules on digital health and artificial intelligence.
Technology has transformed much of our life, from music to banking to social interactions to transportation and shopping, and digital health technology is starting to catch up. The use of artificial intelligence is not new, but has caught the attention of the healthcare world and has the potential to be the next big innovation. Currently, 1 in 3 adults worldwide have multiple chronic conditions. 75% of health consumers expect more personalized healthcare experiences, and 40% of health consumers believe they will continue to use telehealth, up from 11% pre-pandemic. The digital health market continues to grow at a rate of 79% year over year, accelerated by the pandemic. Recent data show that the number of these tools are continuously increasing. The number of health applications available in the App Store continue to grow rapidly. This booming trend resulted from the World Health Organization resolution issued in 2005 that urged countries to prioritize the development of an action plan for implementing and expanding e-health services to promote equitable, affordable, and universal access to healthcare services. This resolution recognized the potential of health technologies to improve population health outcomes by advancing medical services and allowing the exchange and sharing of health information. The United Nations 2030 Sustainable Development Goal Agenda has also highlighted the potential of health technologies to accelerate progress towards achieving health-related SDGs. With this recognition, there has been a growing global consensus in the health community that the use of digital health tools will contribute to ensuring that 1 billion more people will benefit from universal health coverage, will be better protected from health emergencies, and will have enhanced health and well-being. There is no shortage of conditions that can benefit from the use of technology, including high blood pressure, heart attack and heart failure, stroke and post-stroke rehab, atrial fibrillation, peripheral artery disease, cardiac rehab and secondary prevention, and the metabolic syndrome. There also is a range of technologies that can be used to prevent, support, and or manage these conditions, including mHealth, digital health medication adherence, behavioral change and coaching, telemedicine, artificial intelligence, EMR-based interventions, and many others. Digital health tools encompass a wide range of technologies, including mobile applications, health information technology, smart wearable devices, remote monitoring, health platforms, telehealth, and telemedicine, while traditional uses of digital health focus on education and coaching via telehealth services, medication adherence, and symptom management through the use of apps. Digital health has become a multifaceted whole health approach, including removing patient monitoring and connected health, care communication and coordination, including the use of care plans for shared decision-making, to a much greater focus on mental health and behavior change.